For every 5 grams that you increased your fiber consumption, you increase your survival by 30%. So now MD Anderson is like taking the ball and running with this. And they're doing quite fascinating research with melanoma specifically, which is a skin cancer. It's the most deadly form of skin cancer that exists. And one of the ways that they will commonly treat melanoma is with immunotherapy. Now, they've been doing this for about 10 years. And it can be highly effective. But of course, there are people that it does not work for. So how do we determine who are the people that it's good for versus the people that it's not good for? Well, kind of building up to the most recent stuff that's just from a couple of weeks ago. A few years ago, MD Anderson did a study where they gave antibiotics, or they looked at the effect of antibiotics immediately prior to receiving this treatment for melanoma. Antibiotics reduced diversity within the gut microbiome. And what they found is that in doing this, they actually were reducing the effectiveness
That's fascinating.
of their treatment. Taking it a step further, they then took a group of people and they showed that once again, if you have a higher diversity of your microbiome, you are more likely to survive and have a good result from immunotherapy. They gave them a fecal transplant. So they started giving fecal transplants to people. And when you received a fecal transplant to boost your diversity temporarily, people had a better survival and better outcome from immunotherapy.
That's amazing.
So now, bringing it all the way forward to where we are today, more recent research has shown that the diversity within a person's gut microbiome, their gut microbiome, is very relevant to this melanoma. And they've identified specific species. And what's interesting is that the species that you want to have that basically portend a better prognosis are the exact same ones that help us to process and digest our fiber and produce short-chain fatty acids. And these short-chain fatty acids, we can talk about it more later if you want to, but they are the product of fiber degradation by our gut microbes.
Wow.
Fiber is the prebiotic. Our gut microbes are the probiotics. And when they come together, the fiber, the prebiotic with the probiotic bacteria, they basically create this new compound, which we would call a postbiotic. And these are the short-chain fatty acids like butyrate. So they showed in this research that melanoma patients have a better survival if they have higher levels of these butyrate-producing microbes in their gut.
Wow.
So they did a new study looking at dietary fiber. What happens when people are eating more dietary fiber?